part of the treatment for Liz that we are doing, aside from the acupressure, is I have her wearing ACE bandages in order to stabilize the ankle, which has become very unstable since the back injury. And I also had to change her shoes, because the shoes she was wearing, not only were they not good shoes, but they weren't offering the support that she needed. Now, when people have a low back injury, the foot becomes very important for their recovery. If they have instability or any kind of congenital deformation in the foot, like Liz does, a flat foot, as you can see here, we know that this is a disposition for back pain, and definitely was a part, besides of the injury to the spine itself, congenitally she was disposed to have these problems because of her flat feet. So part of the treatment for her is not only getting her through this acute phase of the injury and letting the herniations to heal up, but also to change the arch of the foot so that she will have a stronger foot, and which will make her whole body stronger and her back stronger and prevent these kind of injuries from happening again. Now, in order to do this, we have correctors. These are very special correctors. These are metal, which is the only material which is really strong enough to significantly change the foot. They are custom made, and they'll be worn in her shoes as a therapy. Even though she is 35, it is still not too late to correct these problems in the foot, and that will give her overall a better result. Now, in order for the correctors to be effective, we have to have a proper shoe to wear them in. These, although not very stylish, are very good to offer the support. I like how they have the heel and a whole round toe, and that they lace up tightly around to almost even splint the leg and act as a splint, because her lower leg had become very unstable, especially after the spinal injury, when actually I noticed in the first 6 sessions that her arch, aside from the numbness that started to happen, crippling her toes and her foot, also her arch started to collapse. So it was very important to stop that from happening, because oftentimes what happens in this kind of case is the person's spine gets injured and the low back gets injured, but then degeneration and other kinds of arthrosis, which is a hardening of the tissues, happen as a result of the nerve being compressed. So I want to maintain the health of the lower body and the function of the lower body through the process of healing. Because oftentimes people will heal from herniated discs, but then afterwards they're left with collapsed arches, or contracted Achilles tendons, or shin splints, or plantar fasciitis, and other kinds of joint injury that then becomes more of a problem in the future than the back injury itself, and then leads to further back injury. So we are taking this into consideration as we are treating her, not just for temporarily relief of the pain and the symptoms, but also to make sure that in the future she continues to rehabilitate and get better in order to prevent further injury to those now weakened areas in the spine. And also we are going back in time and correcting things that actually should have been corrected long ago. So now I am working on the vastus medialis, adductor magnus, and the sartorius and gracilis, and semimembranosus and tendinosus of the hamstring group. We do this all from the inner leg here. Again, a very sensitive area, and one has to be very cautious to apply a tolerable amount of pressure so that you can get a good stimulation without irritating the client too much, so that they don't contract. I do not want my patients, even though I'm working on very sensitive areas, I do not want them to contract in response to the pressure that I'm applying. So I go to the point where I start to feel the contraction, and then I back off. Now I work the Achilles tendon and the soleus from the inside leg. Here is an area where sciatic nerve impingement always wants to collect its pressure. And it's very important for the low back to relieve it from this part of the foot.